Hi, my name is David Emerson. I want to welcome you to People Beating Cancer's webinar about the Multiple Myeloma Cancer Coaching Program. I'm going to talk about all 13 cancer coaching guides included in the program, in general, after I talk specifically about one of the guides, the Integrative Therapies Cancer Coaching Guide, to give you an understanding of integrative therapies and what they can do for the multiple myeloma patient. Several things before we get started. As a webinar incentive today, I'm giving away 5 copies of my ebook, Beating Myeloma, If I Knew Then What I Know Now, free to the first 5 people who purchase either the basic or premium myeloma cancer coaching program. 5. I'll give 5 copies of the first 5 people today who purchase either the basic or premium myeloma cancer coaching program. I'll mention this again at the end of the webinar. The ebook chronicles a 6-month cancer coaching relationship I had with a newly diagnosed myeloma patient, Mary, not her real name, Mary who contacted me several months after her diagnosis, and we emailed back and forth to each other over the next 6 months. In effect, the relationship and Mary's questions enabled me to explain virtually everything myeloma patients need to know in their first year. We discussed big issues, small issues, and everything in between, conventional and non-conventional. As I say, I wish I had the information in that ebook when I was first diagnosed with multiple myeloma. As the saying goes, knowledge is power. Nowhere is this philosophy more true than when you are facing a multiple myeloma diagnosis. I imagine many of you are here either because you are currently undergoing treatment for myeloma and aren't feeling so great, or you were recently diagnosed and trying to make sense of all the different decisions facing you right now. I know you feel like there's so much to learn and you might be overwhelmed, but I would like to start by saying that just the fact that you're looking for information online, taking an active role in the management of your disease, means that you are ahead of the curve. I want to help you learn everything you need to know as fast as you can, as thoroughly as you can. And that's what the Multiple Myeloma Cancer Coaching Program is all about. Today, we're going to cover what integrative therapies are and how they can help you in your current treatment regimen become more effective while protecting your body from painful side effects. You will see a link on the right side of your screen prompting you to download an introduction for this webinar. You can follow along with me while I discuss different concepts. While you download and print that, I'd like to briefly share my myeloma experience with you. I was diagnosed with single plasmacytoma in my 5th cervical vertebra in February of '94. I was 34 years old at the time, not yet married, not yet a dad. I underwent surgery to remove the lesion in my 5th cervical vertebrae, and then I underwent local radiation. You can see a faint scar and radiation tattoo, little dots here. My single plasmacytoma developed into multiple myeloma over the next 12 months. In the spring of '95, I underwent 5 courses of a cocktail called VAD chemotherapy, and then in September, I underwent 2 more courses of something called Cytoxan or cyclophosphamide. Finally, in December of '95, I had an autologous stem cell transplant in university hospitals here in Cleveland. The stem cell transplant was initially deemed a success, and I went into remission for 10 months. I relapsed again in '96, went through radiation treatment in my lower back, my iliac crest, and then went into remission again. Finally, I relapsed again in '97, and that was when my oncologist told me that there was nothing more she could do for me. I went through the gamut of conventional therapies that were available at the time for multiple myeloma patients, including surgery, chemo, high-dose chemo, and radiation, only to fail at my main goal, to beat my myeloma and achieve long-term remissions, 1 or more long-term remissions. I'm here today because the research I did online led me to both the treatment that ultimately put me in long-term remission and the protocols that I have followed daily for the past 19 years that continue to keep me cancer-free. My wife Dawn and I have been married for 20 years, and our son Alex graduates from high school this spring. I learned through my experience that in conjunction with an experienced, knowledgeable oncologist, I also needed to educate myself about concepts like remission, partial remission, very good partial remission, relapse, multi-drug resistance, palliation, the risks and rewards of both radiation and chemotherapy, and then how all of these concepts relate to my personal situation. It's a tall order. There's a lot to learn. A lot of the information I have today is information that I wish I had learned earlier in my disease. My life today is significantly impacted by the treatment side effects that I didn't know about at the time. Heart arrhythmia, nerve damage, and chemo brain. I want you to have this information so that you can make the best decisions for yourself in your personal situation. It is my belief that the goal of multiple myeloma patients should be to achieve the deepest, longest remissions possible with the least amount of collateral damage, otherwise known as treatment side effects. The most successful way that I have found to achieve this goal is by learning about both the details of conventional therapies and the benefits of evidence-based non-conventional therapies. They go hand in hand. Of course, there's a lot of information to cover under these two topics. I spent many years researching the various evidence-based studies about multiple myeloma treatments, both conventional or FDA approved and non-conventional. And I started People Beating Cancer because I wanted to help patients and survivors easily access this information in one place from the privacy of your computer. The multiple myeloma cancer coaching package covers 13 different topics in detail in the form of guides that are critical for myeloma patients to understand when making treatment decisions. Right now, I want to do two things. I want to discuss the material found in the Integrative Therapies Guide first, and then we will go over the multiple myeloma cancer coaching package in detail, outlining the 13 different guides. Just as a reminder, you will all receive the Myeloma Integrative Therapies Guide at the end of this webinar, so don't worry if you miss something or are having trouble taking notes. So let's just start with the basics. Let's start by answering the question, what are integrative therapies? Integrative therapies are defined as tools that support the patient's strength, stamina, and quality of life while potentially increasing the efficacy of chemotherapy, of toxic chemotherapy, while decreasing the risk of toxic side effects. One of the things I have found in my own cancer journey was that there was not a comprehensive discussion of the short, long-term, and late-stage side effects of chemo. Let's face it, oncologists are always in a hurry. They have 20 minutes, 30 minutes. They don't talk about short, long-term, and late-stage side effects. They just don't. Studies confirm that 40% of patients will experience chemo-induced brain damage, chemo brain. Another 40% will experience nerve damage, otherwise known as peripheral neuropathy, and a whopping 90% of patients will experience bone damage. I experienced all three. So here we go. I'm going to outline the side effects of each chemotherapy drug found in the Integrative Therapies Guide, then go over the different integrative therapies and how they positively impact your treatment, either by reducing potential side effects or by making the drug more effective, more efficacious in killing myeloma cells. First up, Cytoxan. The technical name is cyclophosphamide. The side effects include nausea and vomiting, short term, bone marrow suppression, the decrease of the production of cells that provide immunity carrying oxygen and allow for normal blood clotting to occur, stomach ache, hemorrhagic cystitis or damage to your bladder, blood in the urine that comes with bladder pain, urgency, diarrhea, myocardial toxicity, which is a fancy word for heart damage, which means that your healthy heart cells are damaged and a darkening of skin and nails. In my experience, conventional oncologists focus mostly on the acute, short-term side effects, such as nausea and vomiting, and less on long-term side effects, such as heart damage. I have a heart murmur, irregular heartbeat, called chronic AFib, and nerve damage today from the chemotherapy I underwent over 20 years ago. The integrative therapies that are helpful for Cytoxan patients are omega-3 fatty acids, fish oil. Studies have found that omega-3s are able to modulate the painful symptoms associated with hemorrhagic cystitis, or bladder damage. The studies are linked in the Integrative Therapies Guide, which you will receive at the end of this webinar. Another one, resveratrol, can prevent hemorrhagic cystitis for Cytoxan patients. Green tea extract can reduce myocardial toxicity and may protect heart cells from damage related to Cytoxan dosing. Revlimid, or lenalidomide. Side effects for Revlimid include thrombosis, blood clots that prevent the proper flow of blood, pulmonary embolus, when a blood clot gets lodged in an artery in your lung and blocks blood flow to that part of the lung, hepatotoxicity, chemical-driven liver damage, bone marrow toxicity resulting in neutropenia, a common side effect of many chemos. This can prevent your body's ability to fight bacteria by reducing your white blood cell count. The integrative therapies for Revlimid are curcumin. Curcumin enhances the efficacy of Revlimid for multiple myeloma. Another common chemo, Velcade, technically bortezomib. Side effects for Velcade include peripheral neuropathy, nerve damage. Many of you may already be experiencing this. Weakness or numbness in the hands and feet as a result of nerve damage. 40% of patients will develop this side effect. I use walking sticks to get around myself due to my peripheral neuropathy. As a note to those of you watching today who have experienced drug resistance in your Velcade treatments, please pay attention in particular to the integrative therapies. It's a fairly long list that I'm going to talk about now because several studies discuss how these supplements can reduce or eliminate myeloma resistance to Velcade. You might be able to minimize multi-drug resistance to Velcade. Integrative therapies include, and there's a long list here, curcumin, which sensitizes multiple myeloma cells to Velcade, omega-3 fatty acids, here we go again with fish oil. Fish oil induces cell death in cancer cells, increases sensitivity to Velcade for multiple myeloma, but not in healthy cells. Cannabidiol, medical marijuana. Cannabidiol can prevent myeloma cells from growing and induce cell death in multiple myeloma cells. We'll talk more about, there's a guide for medical marijuana. Hanukkah, which overcomes drug resistance in myeloma cells and induces cell death in multiple myeloma. Thymoquinone, which overcomes chemoresistance in multiple myeloma cells and enhances the anti-cancer efficacy of Velcade. Another common chemo, melphalan. The side effects include, of course, nausea and vomiting, oral ulcers, you've seen this, bone marrow suppression, again. Integrative therapies for melphalan include, again, curcumin, which reverses multi-drug resistance in myeloma. Next, dexamethasone, which is a corticosteroid, which is commonly included with chemo cocktails. The side effects include aggression, agitation, anxiety, irritability, dizziness. Ask my wife, she'll tell you all these. Fast, slow, or pounding heartbeat, muscle atrophy. The integrative therapies for dexamethasone include curcumin, which can sensitize insulin signaling in dexamethasone-treated cells. Further, resveratrol, which prevents dexamethasone-induced muscle atrophy. Omega-3 fatty acids, again, fish oil, which may prevent muscle atrophy. Like I said earlier in our discussion, the Integrative Therapies Guide that you'll receive shortly has links to the various studies about the efficacy of all these integrative therapies. All 13 guides of the Myeloma Cancer Coaching Program have links to the evidence-based studies. Don't take my word for it, read the studies. Now, I'd like to briefly go over the information that you will find in each of the 13 guides that comprise the Myeloma Cancer Coaching Program and how this information can benefit you, the myeloma patient, survivor, or caregiver. The first guide is the Conventional Myeloma Therapies Guide. Regardless of your stage of diagnosis, your symptoms, or current status, myeloma patients must understand the importance of conventional oncology, of oncologists who specialize in myeloma compared to oncologists who don't. Myeloma specialists, as well as cancer centers with myeloma experience, can make a dramatic difference in the overall survival of a myeloma patient. Links to the most successful myeloma patients and hospitals are listed in this guide. You will have access and the statistics to prove it. 2. The Financial Issues Guide. The financial toxicity, a new phrase, toxicity caused by a diagnosis of multiple myeloma is as severe a side effect of a myeloma diagnosis as any you will face. Regardless of your health insurance coverage, you owe it to your family to learn about financial resources such as Social Security disability, viatical settlements, and more. The third Cancer Coaching Guide, Medical Issues Guide. Years of cancer coaching has taught me that myeloma patients don't know what they don't know. For example, patients don't know that having an autologous stem cell transplant later rather than earlier makes no difference in your overall survival, on average. Myeloma patients don't know about the many endocrine disorders caused by a stem cell transplant. You need to understand these. The Medical Issues Guide addresses many critical issues facing myeloma patients. 4. The Supplementation Guide. The Supplementation Guide lists 18 evidence-based non-toxic supplements that research shows are cytotoxic or apoptotic, kills multiple myeloma. I consider these supplements that I take daily as being non-toxic chemotherapy. 5. The Nutrition Guide. It's not enough to say that diet is critical for myeloma patients before, during, and after therapy. The Nutrition Guide contains an extensive list of anti-angiogenic or anti-myeloma foods and anti-cancer diet for myeloma patients to follow. 6. The Antioxidants Guide. The single most common question I'm asked as a cancer coach is if antioxidant supplementation interferes with conventional therapies. The Antioxidants Guide covers 10 different studies that make the case that antioxidants support the myeloma patient, helping him or her live a better, longer life. 7. The 7th guide, the Integrative Therapies Guide, as we discussed, a growing number of studies show that standard of care, chemotherapy, and radiation can be enhanced by integrative therapies. The Integrative Therapy Guide lists 15 integrative therapies that synergize with 5 common myeloma chemotherapy regimens, as I discussed previously. Myeloma patients can deepen remissions while reducing the risk of side effects of chemotherapy through integrative therapy. The 8th guide is the Bone Health Guide. Multiple myeloma is as much a bone health disease as it is a blood disease, a bone disease, blood disease. Over 90% of myeloma patients will experience bone damage at some point. The Bone Health Guide lists 11 evidence-based, non-toxic bone health therapies. 9. The Non-Conventional Treatment Guide. As I mentioned at the beginning of this introduction, conventional oncology is limited when it comes to managing multiple myeloma. Many myeloma patients have asked me about what I call non-conventional therapies. These are therapies such as antineoplastin therapy, the one that I underwent after I was told that I was end stage that put me in complete remission. The non-conventional treatment guide discusses 8 evidence-based therapies. I think myeloma patients need to understand the full spectrum of therapies. The 10th guide is the Cannabis and Multiple Myeloma Guide. The second most frequently asked question I get is if cannabis or medical marijuana helps myeloma patients. While the research is thin at this stage in the United States, the Cannabis Guide covers cancer pain, cannabis as an integrative therapy, and how cannabis affects myeloma itself. The 11th guide is the Mind-Body Therapy Guide. Living with an incurable cancer, living with a cancer that can relapse at any time is difficult, I can assure you. Myeloma patients must learn to manage themselves mentally as well as physically. The Mind-Body Guide outlines over a dozen evidence-based mind-body therapies directed specifically at people like us, myeloma survivors. The 12th guide is the Detoxification Guide. The news is filled with reporting on how genetics influences cancer. While research does show that genetics does influence 5 to 10% of all cancers, it is critical for the myeloma patient to understand that the other 90 to 95% of cancers are attributed to lifestyle and the environment. The Detoxification Guide explains those evidence-based therapies that can detoxify your body through multiple mechanisms. I do all of these weekly. 13, the Online Support Guide can provide feedback. Online support can provide multiple myeloma feedback from people, myeloma patients just like you. Over the years, I have found this feedback to be essential to my myeloma experiences. Each myeloma cancer coaching client who subscribes at either the basic or premium levels will be invited to join the closed Facebook group called Beating Myeloma that I manage. In addition to the online support guide, there are 20 different general and specific online myeloma support groups for you to choose from. While no one can promise a cure to this complicated, aggressive cancer, I have aggregated the evidence-based therapies that have brought me healing and kept me in complete remission since April of '99. I want to make sure you hear the emphasis, my emphasis when I say evidence-based, because every therapy that I discuss in these guides is supported by scientific research. And no matter what course of personal discovery you take in your cancer journey, I encourage you to be rigorous in making sure that the treatments you choose for yourself are backed by scientific research. The internet is the Wild West. Look for research. The Integrative Therapies Guide that we went over today is one of the 13 guides that you'll receive when you purchase one of the multiple myeloma cancer coaching packages. The packages come in 2 levels, basic and premium. The basic package is $199 and includes all 13 guides, plus membership in the closed Facebook group that I administer, Beating Myeloma. A closed group means that no one can post or read except for approved members. The premium package is $299, and you'll receive all 13 cancer coaching guides, all offerings of the basic package, plus 1 hour of one-on-one individual coaching with me via Skype, email, or over the phone. Your choice. Keep in mind that you can use your consulting time with me any way you would like. While most clients just want to have a one-on-one discussion with me personally, there are other clients who arrange to have me join them virtually in their appointment with an oncologist. I understand basic concepts, questions, comments, dealing with the patient wants. Your choice. As a thank you for listening to today's webinar, I would like to offer you $100 off of the package of your choosing. You will receive a coupon code along with a link to the cancer coaching packages after this webinar. $100 off. Also remember that my offer at the beginning of the webinar that I will give the first 5 people who buy today a copy of my ebook, Beating Myeloma, if I knew then what I know now. As you're thinking this over, I would like to let you know that the funds raised from the sale of these packages goes directly into continuing the research and operation of People Beating Cancer, a registered 501c3 nonprofit organization. Our mission is to demystify cancer, and People Beating Cancer is dedicated to reaching cancer survivors and caregivers all over the world through the internet with the information they need to live longer, healthier lives. It's fascinating to see what countries cancer coaching I do all over the world. People Beating Cancer is fully funded through grants and donations from both individuals and grant-making organizations, and, just like PBS, by viewers like you. In this way, People Beating Cancer is able to remain an independent, unbiased source of information. Your purchase of a multiple myeloma cancer coaching package helps to further the mission of People Beating Cancer. So it's a win-win, you and me. You can help yourself and fellow cancer survivors at the same time. We've come to the end of our webinar, and I want to thank you for joining me. I wish you every success in your personal cancer journey, and I hope that you found this webinar to be helpful to you in the decisions that you are facing now and in the future. I appreciate your time. Thank you.